Hello everybody. Today we will start a new system, the respiratory system. Its name tells you the main function of this system, which is respiration or breathing. First we'll see the parts of the respiratory system. Then we'll talk about 4 processes of respiration. Then we'll talk about the organs of the respiratory system. The uppermost organ or structure is the nose. Inside the nose you have the nasal cavity, so you only see a small part of nose from outside, the external nose, but inside the nose you have the nasal cavity that we don't see from outside. Then you have the pharynx. Next to the nose is next organ is the pharynx, and then larynx, then trachea. And trachea divides into 2 branches. So lower end of trachea, this is the trachea, divides into 2 branches. So this is the trachea, and these 2 are called the primary or main bronchus. Okay, primary or main. This is the left primary or main bronchus. This is the right primary or main bronchus. Now the term bronchus is singular if I indicate only one, bronchus. If I indicate both, plural is chi or bronchi. So this is plural, cus is singular. Okay, so bronchi or bronchi, plural. Why 2? Because the right bronchus enters into the right lung, and left bronchus enters into the left lung. Okay, and then inside the lung the bronchus divides into many divisions. First divisions are called the lower bronchi, and then lower bronchi divide into again smaller and further smaller branches. Okay, and those are bronchioles. Bronchioles. Okay, so inside the lung the primary or main bronchus divides into lower bronchi, and then many smaller bronchioles. So inside the lung the bronchioles look like a tree. You know, tree has many branches, and larger branches give smaller branches, right? So that's why the whole thing inside the lung is called the bronchial tree. Okay, we'll see what are those bronchioles inside the lung. Okay, then we'll talk about the respiratory membrane. It is a membrane or a structure through which the gas exchange occurs. Okay, so through this structure, what happens? Through this membrane, gas exchange take place, okay, between the alveoli of the lung and blood in the capillary. Okay, so between the lung and the blood, the gas exchange occurs inside the lung through the respiratory membrane. Okay, then we'll talk about the pleura. The lung has connective tissue covering, and that is called the pleura. And pleura, so pleura is the covering of the lung. Okay, and it has two layers. We'll talk about that. Then we'll talk about a fluid that is called surfactant and the mechanism of respiration or breathing. Okay, so the covering of the lung is the pleura. We'll talk about that, and then we'll talk about the mechanisms of breathing or respiration. Respiration has two phases. One is called inhalation or inspiration. Inspiration, which is also called inhalation, and expiration, which is also called exhalation. So expiration and inspiration, okay, or exhalation. So those are the things we'll talk in this part of the respiratory system. So first see the organs or parts of the respiratory system. If you start from the top, as I said, nose. Inside the nose you have the nasal cavity, and around the nose you have paranasal sinuses. Sinuses are the cavities inside the bones. So inside the facial bones you have some cavities. Then you have pharynx, which is a muscular tube. Okay, muscular tube, and most part of it is a common passage for food and air. So most part of the pharynx is common for the food and air. Okay, only the uppermost part is for the air, that is called nasopharynx. So only the nasopharynx is for the air. Nasopharynx is for air, and other parts are for both the food and air. Then larynx. Next to the pharynx is the larynx, and which is also known as voice box or sound box. Why? Because inside the larynx you have the vocal cords. Okay, vocal cords that produce sound. And larynx is a mainly a cartilaginous structure. So pharynx is muscular, larynx is mostly cartilaginous structure made of cartilages. So we'll talk about those cartilages too. Then next to the larynx is the trachea, which is also called wind pipe. Common people say windpipe. And trachea consists of muscle and cartilage. So muscle is called trachealis muscle, and cartilage. cartilage. Okay, so tracheal is muscle and cartilage. So you see here, pharynx is muscular, larynx is cartilaginous, and trachea is both muscular and cartilaginous. Okay, then I told you the lower end of trachea divides into two bronchi, primary or main bronchi, and they enter into your right and left lungs. So two bronchi, right and left, right and left bronchi, and then they divide again and again inside the lung to form the bronchial tree. Okay, so bronchial tree, and then lungs are the last organs, and inside the lung you have the air balls. Those are called alveoli. Okay, million of air balls called the alveoli of the lung. So those are the organs. So here you see this is the nasal cavity here, then the pharynx, and this is the larynx. So this part of pharynx, only the upper part, nasopharynx for air, and this part you see air comes from the nasopharynx this way, and food, this is the oral cavity or mouth, also enters into the lower part of the pharynx. Okay, so that's why it is both for the air and the food. And then this part is important. You see here in the back you have the esophagus, you have the esophagus in the back, and in the front you have the larynx. So here the food and air get separated. The passage for the air is the larynx, only for air, and only for food is the esophagus. Okay, so this is the epiglottis. You see this structure, it moves up and down to close and open the laryngeal inlet or entrance of the larynx. So when you swallow the food, it comes down to close the laryngeal opening, so food will only enter into the esophagus. Okay, here. And when you breathe, then it goes up, opens the laryngeal inlet, and the air gets in and out. Okay, so here you see the trachea divides into two bronchi and then the lung. Okay, now the lungs sit on the diaphragm. So this is the diaphragm, this one, this muscle, flat muscle that separates the thoracic and abdominal cavities, and your lungs sit on the diaphragm, as well as your heart. Heart is located here, right? So your heart also sits on the diaphragm like this. So if you see the lungs, the upper end of the lung is pointed or narrow. That part is called the apex of the lung. So upper pointed end is the apex. Okay, and the bottom wide part that rests on the diaphragm, that is called the base. So base of the diaphragm rests on base of the lung rests on the diaphragm, right, and strongly attached by fibrous tissue. So here strongly the bottom of the lung is attached to the diaphragm. So now just think that if diaphragm moves down, it pulls the bottom of the lung downwards. Make sense? That is very important. We'll talk about that later. So apex and the base. Now if you see the right and left lung, the right lung is, if I draw here, right lung is short and wide. So this is right lung. It is short and wide. That means vertically this way it is short, but this way it is broader or wider. Okay. Left lung is relatively long and narrow. So this is the left lung, which is opposite, longer, slightly longer and narrow than the right. Okay, so that is one difference. Right lung has two fissures. Fissures means deep groove or cut. We can think cut. So deep grooves separate the right lung into three lobes. Okay, you see, upper lobe or superior lobe, middle lobe, and inferior or lower lobe. So in right lung, you have three lobes separated by two fissures, deep grooves. Okay, two fissures. Make sense? So that is the right lung. In left lung, you have only one fissure and therefore two lobes, upper or superior, lower or inferior. So in left lung, uh, you have two lobes, that means separated by one fissure. Okay, and another thing, if you see the left lung has a notch here. That means an U-shape part, that is called the cardiac notch, because we know that most part of your heart is in the left side, right? So to give some room to the heart, you have a notch in the left lung or depression there, and that is called the cardiac notch. So in left lung you have cardiac notch. Cardiac because of heart, and right lung has no cardiac notch. Okay, so those are a few external differences between the right and left lung. Okay. Now, why the right lung is shorter than the left lung? The reason is, in your right side, most part of the liver is located in the right side, just under the lung. So to give room to your liver, the lung is pushed up, okay, during development. Since the liver is growing here just under the right lung, that's why the right lung gets shorter. And for the heart, left lung gets the cardiac notch. Okay. Now let's see the name of these fissures. This fissure, the upper one in the right lung, is called the transverse or horizontal fissure because it is transversely located. And this one, lower one, is called the oblique fissure. So horizontal and oblique fissures. And in left lung, you only have oblique fissure. Okay. So the right and left lungs. Now let me talk about one more important structure, which is the pleura of the lung. the covering pleura is a double layered structure. So it has two layers like the pericardium of the heart. Okay, double layered structure. And you see, this is the lung, and the inner layer of the pleura is attached to the lung, directly attached to the lung. This is the inner layer of the pleura, and that is called the visceral pleura. Okay, so this is the visceral pleura or visceral layer of pleura, same thing. And then this visceral pleura, what happens is, see, actually this is your lung, and this is your chest wall. Okay, so these are the ribs. Okay, so muscles, intercostal muscles. So this is the chest wall. So this is the chest wall. Okay, so and this is the diaphragm, you know that. So the inner layer of the pleura is attached to the surface of the lung like this, and then folds here like this, and this is the outer layer, gets attached to the chest wall, inner surface of the chest wall. Okay, so this is the visceral layer, and this one is the parietal layer. Parietal and the one attached to the lung, that is the visceral layer. Okay, so parietal pleura and visceral pleura. Okay, and the space in between, you see, this is the space that is called pleural space. So this space between those two layers is called the pleural space, which is important. Why? Because this pleural space, it is also this side, same thing, like this. Okay, so this pleural space contains a fluid that is called pleural fluid. Okay, so it is partially, a small amount of fluid is there, but that fluid is a lubricating fluid. That means it is slippery, and when you inhale and exhale the air, lung gets smaller and bigger, right? Makes sense. And these two layers move in opposite direction, so they move to opposite direction, and this fluid, pleural fluid, since it is lubricating, it reduces the friction, okay, the chance of friction between these two layers, so for a smooth, you know, movement. Now it is like pericardial fluid and pericardium. Now a clinical condition that is called pleuritis. Itis, okay, inflammation, also called pleurisy. Same thing, okay. So pleuritis or pleurisy is the inflammation of the linings or layers of the lung. That means the inflammation of the pleura, those two layers, okay. And when inflammation occurs, then what happens? You know, inflammation causes swelling, right? So those two layers get swelled, and that causes the friction between those two layers when you breathe, and that creates pain. So the friction between the two layers create pain. It's like two sandpapers you are, rubbing against each other. So that causes sharp pain during breathing. If you stop breathing, the pain will not be felt, but when you are breathing, the layers are moving, right? So you will feel pain. And also, you might have fever. Any infection can cause fever, right? Um, so that is a clinical condition related to the pleura. Okay. Also, inflammation of nasal cavity is called rhinitis. Rhino indicates, rhinoceros, nose. So rhinitis, rhino is nose, itis is inflammation of the nasal cavity, right? Uh, Laryngitis, you all have heard it, laryngitis, inflammation of the larynx. In this case, what will happen, since the voice box is the larynx, so the person's voice will change, will become husky, and that happens. You have probably seen the patient of laryngitis. It's pretty common. Pharyngitis, inflammation of the pharynx. Redness, if you ask the person to open big the mouth, you can look in the back all the way. Redness. Pharynx. So if you ask the person to open the mouth and push the tongue with a spoon or something, the handle of this spoon or a stick down, you can see the pharynx in the back. So pharyngitis. So all these are commonly heard. Inflammation of the upper respiratory tract. Okay, so inside the lung, as I told you, primary or main bronchi, right and left, enter into the lung, and then they divide inside the lung into lobar or secondary bronchi. Same thing, okay, lobar or secondary bronchi. Then they branch further to form the tertiary bronchi and then bronchioles. Okay, then the terminal bronchioles. Now, bronchioles are very narrow branches. They are less than 1 millimeter in diameter. Okay, so really very narrow uh, branches or tubes. And then terminal bronchioles are more smaller, small. That means less than half millimeter in diameter. So smaller than the bronchioles. And then after terminal bronchiole, that is not the end. You have three more structures after the terminal bronchiole. What are those three structures? Respiratory bronchiole, respiratory bronchioles, then alveolar ducts, and then alveoli. Okay, so these three are after the terminal bronchiole. Now, these three are very important. Why? Because gas exchange gas exchange occurs through the wall of these three structures. Although most of the gas exchange occur through the alveolar wall, but small amount also occurs through the alveolar duct and the respiratory bronchioles. Make sense? So only these three structures, the last three structures, are for the gas exchange. All other structures from your nose, then pharynx, then larynx, okay, then trachea. These are the structures, right? And then primary bronchi, secondary bronchi, tertiary bronchi, bronchioles, terminal bronchioles. From the nose to all the way terminal bronchial, these structures are to conduct the air conduction. That means taking the air into the gas exchange area. So conducting part or conducting zone. Why we say from the nose to all the way terminal bronchial as conducting zone? Because these structures are only to transport the air from the outside to the gas exchange structures. No gas exchange occurs in these structures. Only gas exchange only occurs in these last three structures. Okay, so now you see we can divide the entire respiratory pathway into two parts. The upper part from the nose to the terminal bronchial belongs to the conducting zone, and the last three structures belong to the gas exchange zone or respiratory zone. So just remember, we divide the respiratory pathway into those two parts. Here you see the bronchial tree inside the lung, right? And you also see the three lobes in the right lung, two lobes in the left lung, two fissures. This is the horizontal or transverse fissure, and this is the oblique fissure. And in left lung, you only have the oblique fissure, okay? And in left lung, you have the cardiac notch here, okay? So we already know the conducting and gas exchange or respiratory zone. Now let's talk about few respiratory organs individually. First, the nose. As I told you, only small part of the nose you can see from the outside, that is the external nose, and inside the nose you have the cavity, that's the nasal cavity. Now nasal cavity or nose performs few important functions. One is when we inhale the air, that air gets moistened and warm when it passes through the nasal cavity. Why? Because the wall of the nasal cavity is moist. You know that inside the nose, right? It is moist all the time. So when the air gets into the nasal cavity, it comes contact to the wall of the nasal cavity, which is moist, and that's why the air, if the air is dry, this is really helpful to make it moist. And also the air gets warm. Why? Because the wall is not only moist but also warm. Now why wall is moist and warm? Because from the epithelial lining of the nasal cavity, mucus is secreted. Okay, so mucus is secreted, which is slippery and moist. And why the wall of the nasal cavity is warm? Because in the wall of the nasal cavity you have lot of blood flow, blood circulation, and all of you know already that blood is slightly warmer than the body, right? So when the air comes contact to the moist and warm surface of the wall of the nasal cavity, the entering air will get moist and warm, which is very important actually. In cold weather, if you inhale the cold air, if it directly goes to the cold and dry, if it directly goes to the lung, it can cause the infection in the lung and pneumonia. So that actually helps to make the cold air warm before it enters into the lung. Filters and cleans inspired air. Two ways nasal cavity filters and cleans the air. One is inside the nasal cavity you have hair, you all know, and that will block the dust particles. Okay, and if the dust particles are big, of course they will be blocked by the hair. Also, the moist surface, sticky moist surface, due to mucus, that will trap the dust. Small dust particles will get attached to the wall because the wall is sticky. Okay, sticky wall will also you know uh, trap the dust. And serves as a resonating chamber for speech. Your nose plays a role to improve the quality of your speech. Around the nose you have paranasal sinuses, and because of those sinuses around the nasal cavity, the sound quality is improved, okay, and intensified. uh, Now you all know very simple way to know if nose has any role to improving the quality of sound. If I block your nose and ask you to talk, then your you know um, sound will be different, right? Also, you know when you get cold, the nose is closed, then the sound changes, the voice changes. So we know that plays important role, your nose, to improve the quality of the sound, okay, or speech. Smell and taste. Smell is very important for really taste the food, okay. uh, Now the word we use, flavor of the food. So flavor of food. What is that? Flavor actually includes taste, not only taste, also smell. Those two things together gives you the real flavor of the food, okay. And you know that of course we have olfactory receptors or smell receptors in the nasal cavity, the epithelium of the nasal cavity, and that helps you to smell by the nose. And also we know that without smell we will not really enjoy the taste of the food. You all know when you get cold, right, you don't smell the food, you really don't enjoy the food 100%. So both taste and smell are your nose helping in those two things to enjoy your life. Okay, so functions of the nose. Then inside the nasal cavity, you will see a septum partition, and that septum is in the middle. And you all know that you can, you put your finger and touch the nasal septum, and nasal septum uh, divides the nasal cavity into two hubs. Okay, two hubs. And in the lateral wall of the nasal cavity, you have concha. Okay, this spelling is wrong. Let me see. Nasal. Concha. Superior, middle, inferior. We also say concha or concha. Nasal, concha superior, middle, inferior. Three in each side, in the lateral wall, like this. Okay, so this is the wall, lateral wall, and you have three concha: superior, middle, and inferior. Now they are separated by the grooves, and these are called metastases. Okay, so there are three metastases and three concha in the nasal, in each side of the lateral wall. Then the roof roof of the nasal cavity is formed by two bones, the ethmoid and sphenoid. Floor of the nasal cavity is the palate. Now remember, palate separates your oral cavity and nasal cavity. Okay, so this is the palate. You can touch the palate. You put your finger inside your mouth and move up, or you can touch the roof of the mouth by your tongue. So this is the mouth or oral cavity, and this is the nasal cavity. Okay, so this is the palate. So palate actually separates the oral cavity or mouth and nasal cavity. Above the palate is the nasal cavity, below the palate is the oral cavity. Now I can say that the roof of the mouth is the palate, and the floor of the nasal cavity is the palate. Okay, now palate has two parts. The bony part is called the hard palate. This part is the bony part. This is the front. Anterior two-third, anterior two-third is bony, called the hard palate. Makes sense? Bone is hard, hard palate. Okay, and posterior one-third part is formed by skeletal muscle. This part, which is covered by thick mucosa, like this. So mainly skeletal muscle covered by thick mucosa, and that is the soft palate. Okay, soft because muscular, soft palate. Okay, so the palate is formed by the bone and the skeletal muscle. The bony part is the hard palate, anterior two-third, and muscular part is soft palate, posterior one-third. And now two bones form the hard palate. The front part is the maxilla, and the back part is the palatine. This one is easy to understand. Palatine bone forms the palate. So also we know that maxilla is the bone, which forms the upper jaw. so that makes sense. So palatine. Okay, so the maxilla and palatine, these two bones form the hard palate. Okay, and the lining of the nasal cavity is the mucosa that I mentioned before. It secretes that mucus, and a lot of that mucus has important functions to keep the surface moist, sticky, so helps to moist the air that enters into the lung and makes it warm, and also cleans the air. So here you see the nasal cavity. This is one side. So these are conchae and these are metastases, these grooves that separate the conchae. So three metastases separate three conchae. The concha helps you uh, the air you inhale that passes through the nasal cavity. The concha helps to create air turbulence in the air. Okay, so the air will get touch to the wall and will get warm and help to get moist. Also, the dust will get attached to the surface better. So that is the function of the concha. Now you see the roof. This is the ethmoid and this is the sphenoid. So these two bones, and you remember in the ethmoid bone you have seen the cribriform plate has many tiny holes, olfactory foramina. So what happens, the smell receptors send the olfactory nerve fibers that go to the brain, right? Take the smell signal through the olfactory foramina. So olfactory foramina in the ethmoid bone are for the olfactory nerve fibers that take the smell signal from the nasal cavity to the brain. Okay, and this is the sphenoid in the back. So that is the roof, and this is the floor. You see the hard palate in the front, and this is the soft palate in the back. Okay, now next to the nose is the pharynx, and I mentioned that pharynx, uh, most part of it is for the air and the food, common passes, except the upper part, right, which is behind the nose. So air from the nose enters into this upper part of the pharynx, which is called the nasopharynx. Okay, so this part is only for what? Only for the air, this part of pharynx. In the back or posterior wall of the nasopharynx, you have the pharyngeal tonsil attached, this one, which is also called adenoid. And adenoidectomy, you probably heard. Adenoidectomy is the surgical removal of the pharyngeal tonsil. Why it is called adenectomy? Because pharyngeal tonsil is also called adenoid, and ectomy is removal, dissection. Okay, and this is the opening for auditory tube or pharyngotympanic tube. Okay, it connects the nasopharynx, this end, and other end of that tube goes to the middle ear. Okay, and the tube helps to maintain the equilibrium of pressure. If the pressure inside the ear increases, then through this tube the air will enter into the nasopharynx. Okay, so that way the pressure inside the ear will go down, which is important. Okay, in small children, this tube is short and more horizontal like this. So what happens because of the smaller head? So the fluid from the nose can easily go to the ear and cause the ear infection. That's why, small kids often get ear infection. As the head grows, the tube gets longer, makes sense. The distance between the ear and the pharynx increases, as well as it gets more oblique. So uh, the fluid cannot easily go from the nose to the ear. Okay, so you see that infection doesn't happen or occur that often in the older people. Okay, so that is the nasopharynx. And then the lower two parts of pharynx, oropharynx and laryngopharynx. Oropharynx is behind the oral cavity. So here, this is the oral cavity. So food also enters into this part, right? As well as air comes from above. And then laryngopharynx is the last part of the pharynx, close to the larynx. And then you see here, I mentioned before, the food will enter into the esophagus and air will enter into the larynx. Okay, so here the food and air get separated. Okay, you have two separate passes for them. Esophagus will take the food to the stomach, larynx will take the air to the trachea and to the lung. Okay, now the last thing here, you see the nasopharynx, since it is only for the air, its epithelial lining is pseudostratified columnar. Okay, you must remember that pseudostratified columnar, if you remember from ANP1, it looks like multiple layer but actually a single layer because the height of the cells different, right? And uh, what is important here is that in pseudostratified columnar you have cilia, hair like soft hair like structures, cilia, and they beat and move the mucus, that dirty mucus that traps the dust, uh, and push the mucus down towards the stomach. Inside the stomach you have acid, right? So that will be destroyed if there is any microorganism or antigen. So anyway, so why the lining of the nasopharynx as well as the nasal cavity is pseudostratified columnar? Because these cells, epithelial cells, have cilia and they all the time beat to push the mucus towards the stomach downwards. Okay, so that is very helpful. uh, Now let's see the oropharynx and laryngopharynx. Since these are also for the passage of food, the epithelial lining of these two is stratified squamous. Now remember, if you don't know, stratified squamous, I mentioned before, many layers of squamous cells to reduce the friction, protect your wall from friction. Why? Because food passes through these two parts. So food causes friction, and that's why you need that layer of stratified squamous to prevent the lesion or inflammation. Okay, because food is hard, air is not. Okay. Okay, so those are the things you need to know from this slide. Then let's move forward. So I have already mentioned that mucosa, you see, pseudostratified columnar epithelium have cilia, right? And the mucus, which is uh, slippery, I mentioned, and is sticky. Okay, keep the surface moist. And another type of secretion also occurs from the mucosa, not only mucus, that is called serous secretion, which is uh, more watery, not slippery, more water-like secretion. Okay, and this is more like sticky, thick secretion, mucus. And the serous secretion contains lysozyme and defensin. These two help to destroy the microorganisms, antigens. Okay, so these are very important, lysozyme and defensin. Cilia moves, and I mentioned it, cilia plural move, and inspired air get warmed because of a lot of blood flow, a lot of capillaries there and veins. Now another thing, in the wall of the nasal cavity, you have many sensory nerve endings in the mucosa, in the inner lining, and that's why inside the nose is very sensitive. You know that if you put something inside the nose, you will sneeze. Why? It is highly sensitive because you have plenty of sensory nerve endings there. So that makes the uh, nasal cavity sensitive, the wall of the nasal cavity very sensitive, and which is very good protection. If something enters into the nose, then you will sneeze to take it, push it out forcefully, right? uh, and sneeze is very, very powerful because of its high speed. And if some toxic chemicals try to enter into your nose, you will sneeze, and that is detected by the nasal cavity. So that is a good protection. Before it enters into your lung, it will be expelled out by sneezing. Okay. uh, so now the processes of respiration. There are four processes of respiration. First two occur in the respiratory system, and last two occur in the circulatory system. That's why we say that respiratory system and circulatory system, these two systems work very closely together. Without one, the other will not be able to work. If your respiratory system doesn't work, then no meaning of circulation. If oxygen doesn't enter into the blood, circulation is meaningless, right? If carbon dioxide is not transported by the blood, no point of expelling the air out. So these two systems work together, and the first two steps or processes work in the respiratory system: the pulmonary ventilation and external respiration. Pulmonary ventilation is simple breathing, inhalation and exhalation. Okay, taking the air in and pushing it out. So that is pulmonary ventilation. External respiration occurs in the lung. In the lung. So we all know what happens in the lung. If I ask you what happens in the lung, gas exchange. Gas exchange occurs in the lung. Which gases? Oxygen and carbon dioxide. We all know these things, right? Now, if I ask you why blood goes to the lung, blood goes to the lung to get oxygen from the lung, right? So we know that lung gives oxygen to the blood, and carbon dioxide always moves to opposite direction, remember. So this is the rule: oxygen and carbon dioxide move in opposite direction. So if you know one, you can answer another. Why blood goes to the lung? to get the oxygen, right? So from the lung, oxygen enters into the blood. So now I can tell carbon dioxide from the blood goes to the lung, opposite direction. And that is the gas exchange inside the lung, and that is called the external respiration. It occurs inside the lung. Okay. Then what happens? Blood gets the oxygen from the lung and takes the oxygen to the body, to the tissue, because tissue needs oxygen for metabolism. We know that. And tissue produces carbon dioxide. So carbon dioxide is taken by the blood to the lung to expel it out, to push it out from the lung. So blood does what? Takes the oxygen from the heart to the body, and carbon dioxide is taken from the body to the lung and expelled outside of the body from the lung. Okay, so that is the transport. And who does the transport? The blood carries those two. Then internal respiration occurs in the tissue. Okay, so what happens in the tissue? This is your tissue, you already know. Blood, this is the capillary, so blood inside. Now if I ask you why blood goes to the tissue, I just mentioned to give oxygen to the tissue. Okay, so oxygen goes from the blood to the tissue, we all know that. And carbon dioxide always moves in opposite direction, so carbon dioxide from the tissue will go to the blood. So what happens in the tissue? The gas exchange, that is called what? Internal respiration. What happens in the lung? That is the external respiration. Just very simple. In the lung, external; in the tissue, internal. Okay. We have already talked about three parts of the pharynx, and here by three different colors you see three parts of the pharynx. We have already talked about nasopharynx, oropharynx, laryngopharynx. I have shown you those parts. Now the larynx. Larynx is, I mentioned, a cartilaginous, mostly cartilaginous structure. So in the larynx you have two types of cartilages, paired and unpaired. That means single, unpaired. Sorry, unpaired and paired. Okay, so two types of cartilages. Unpaired, only one, and these are larger. One is called the thyroid cartilage. Okay, cartilage. And second larger, this is the largest one by the way, and second larger is the cricoid cartilage, and these are only one piece. Okay, so thyroid and cricoid, those are unpaired. Then you have three pairs of small cartilages, those are two in number: arytenoid, cuneiform, and corniculate. Okay, now thyroid is the largest one, and from outside you see that as Adam's apple. Okay, uh, and that is prominent in male, right? Adult male person. Why? Because this thyroid cartilage is sensitive to testosterone, male sex hormone, and when at puberty the male sex hormone testosterone is released in the body, this cartilage suddenly gets larger, because it is sensitive to testosterone. Okay, and that is the Adam's apple. Male characteristic. Cricoid is second larger one. Okay, and then you have those three pairs of small cartilages. Okay, and then there is another cartilage, that is the epiglottis. I mentioned it before. It covers the laryngeal inlet. Epiglottis. It is a cap that covers the laryngeal inlet. So if this is the larynx, okay, this is the inlet entrance of the larynx, and you have the epiglottis like this. So it will open and close, and epiglottis is like a cap on the laryngeal inlet, and it is an elastic cartilage. So that is helpful because elasticity helps it to move easily. Elastic, EE, remember, elastic cartilage. You remember three types of cartilage: elastic, hyaline, and fibro. All other respiratory cartilages are hyaline except the epiglottis. All cartilages are hyaline type except the epiglottis. So your nasal septum, in your trachea, bronchi, in your larynx, all cartilages are hyaline type cartilage except the epiglottis, which is elastic. Okay, so here this is the larynx. From, you see, uh, from here that's the lower end, and this is the upper end. So this is the hyoid bone. So this is the upper and this is the lower end of the larynx, and this is the beginning of the trachea. Okay, so this part is actually upper part of the trachea. Now you see, this is the thyroid cartilage and this is the cricoid. Those two are big, right? And this is the epiglottis, see, and in the front you can see a couple of ligaments. One is flat, that is also called membrane. And why this one is called thyrohyoid? Very simple. You see this ligament, which is flat like a membrane, connects the thyroid cartilage and hyoid bone. That's why it is called thyrohyoid membrane. And this one is connecting cricoid and thyroid. That's why called cricothyroid ligament. So we are starting from the bottom one. Okay, cricothyroid, thyrohyoid. No muscle here. And then you see the upper part of the trachea, and these are the tracheal cartilages, right? And tracheal cartilages are C-shaped cartilages. So in the back it is not like a round circle. In the front part it is circle, you can see that, but in the back it is open like this, and this part is filled by smooth muscle. So actually from the front, although you don't see, but the cartilages are C-shaped like this, and both ends are connected by trachealis muscle, smooth muscle. And this is cartilage, C-shaped cartilage. Okay. Okay. Now let's go. If you cut the larynx and see, you can see inside the paired cartilages, three pairs. You remember, cuneiform. This is one side, so in the other side you have exactly the same. You have corniculate and arytenoid. Okay, so those are small cartilages. They support the ligaments, and that is the function. Now, the inside the larynx, you remember I said you have the vocal cords. So this is one side, one vocal cord. You have another one in the other side, and above the vocal cord you have a false vocal cord. This one is not responsible for sound production. The vocal cord is responsible for the production of sound, and this one is called false vocal cord or vestibular fold. Now here you can see this is the vocal cord or fold, and this is the vestibular fold, or sorry, the white one. This is the vocal, this one, and this is the vestibular. So this is the true vocal fold. Now, when you talk, this vocal cords move, get relaxed and stiff, and sometime you'll see the opening between these two vocal cords get larger, sometimes they get small, sometimes they get closed. So this is the closed, opening is closed between the vocal cords or folds, and this is the open stage. Now when you talk, it very in high frequency changes, gets smaller, bigger, or closer. Okay, and this opening is called glottis. So glottis, remember, is the opening. And if inflammation occurs in the larynx, that will cause inflammation of the vocal cords, and that will change the voice or sound. Laryngitis, we talked about that. Trachea. Trachea is also pseudostratified ciliated columnar because the mucus is secreted inside the trachea too, and that should be pushed down. Okay, and in the wall of the trachea, if you make a cross section, you'll see 3 layers in the wall. You remember in the back you have the smooth muscle, trachealis muscle, and in the front you have C-shaped cartilage, right? So this is tracheal cartilage. This muscle is called trachealis muscle. Okay, trachealis muscle. Now it has 3 layers in the wall: mucosa, submucosa, and adventitia. So you will be able to see 3 layers. Okay, mucosa, then submucosa, and then adventitia. The cartilage is in the adventitia, in the outermost layer. Okay, so those are 3 layers: mucosa, submucosa, adventitia, and the muscle, trachealis muscle, is here. Okay, muscle. Now the last piece, all tracheal cartilages are C-shaped except the last one, which is kind of V-shaped cartilage, not C. The last one, where the trachea divides into 2 primary or main bronchi. Remember that? So this one is called the carina, the last V-shaped cartilage of the trachea, the lowermost one. Here you see the cross section of the trachea, so 3 layers. This is the mucosa, ciliated columnar is cilia. Then submucosa has the seromucous gland, so secretes mucus, that thick, sticky, slippery, and serous glands secrete watery secretion. You remember I mentioned that. So together called seromucous gland. So mucus part secretes thick and slippery, sticky, and the serous is watery. watery. Okay. Now this one has lysozyme and defensin to kill the bacteria, and so in submucosa you have the glands, and the outermost layer adventitia has the C-shaped cartilage. You see this is hyaline cartilage, C-shaped, and this is trachealis muscle here. Same thing under the microscope. Respiratory zone, I have mentioned three structures, the last three parts. Okay. In the lung you have about 300 million alveoli. So just think that how small the alveoli are, and alveoli are actually the tiny air balls. Now last three structures, respiratory bronchial, then the alveolar ducts. So these are alveolar ducts, and the alveoli are attached to the ducts, and like a cluster of alveoli. It is like the grape you buy from the store. You know that the grapes are attached to the tiny branches. Okay, so each cluster is called alveolar sac. Alveolar sac contains many alveoli. Okay, so respiratory bronchial, alveolar duct, and alveoli. Gas exchange occurs through the wall of these structures. Most of the gas exchange occurs through the wall of the alveoli. Okay, here you see the respiratory bronchial, then alveolar ducts, and then alveoli. Okay. Okay, so we'll stop here and start from the next slide in next lecture. Okay.